see that.
We're good.
Just to make sure, can you guys both see and hear me?
Yes.
Yep.
Sean, can you X out the recording windows? So
Oh, okay. Here, I'm messing you guys up. Okay, go ahead.
Can you guys both see and hear me?
Yeah.
Okay, so for my project, I decided to go with the topic of art therapy and coloring. Before I begin, I want you to take a brief minute and think back to the way early years of your childhood. And I want to ask you, do you remember creating these sort of masterpieces like you see, or spending time coloring in your coloring books? Well, assuming that you could remember something, I'm going to guess that most of you answered yes to both of those questions. But how many of you continue to occupy your little amount of free time taking part in something creative like you used to as a child? Just to give you a brief background, art therapy is a form of psychotherapy that involves encouraging patients to fully express themselves through the process of drawing, painting, modeling, kind of whatever they want to do to display it. And I think all of you know what the concept of coloring is, so I don't really need to explain it. So, the field of art therapy covers a broad sense of crowds. People in the ages of at least 4 years old and as old as 90 are able to do this, as well as everyone else in between those age gaps, which you can see in the picture to the right. Although you may not think there's a lot of benefits associated with this specific topic, there's actually a multitude of good things to come with this. Some of the good things that you can see listed below include, but aren't exactly limited to, alleviating symptoms of depression, reducing stresses, stimulating creativity, bettering an individual's communication skills, and increasing an individual's mental clarity. Just some more of the benefits associated with art therapy and coloring also include enhancing behavioral adjustments, personal insights, and regulating emotions and impulses that help with their integration, which is basically them bringing in all their emotions into one picture together. Art therapy and coloring also help to improve an individual's motor skills, focus, and hand-eye coordination. It prepares children for school while bettering their handwriting skills. It helps to better sleep qualities and attention spans and makes individuals' thinking more flexible. Now, you may be asking yourself if a simple art class is the same thing as this art therapy and coloring. Actually, they're two different topics. Regular art classes focus simply on creating a finished project through some kind of a learned technique that's taught to us, whereas art therapy and coloring are developed more for an individual's focus on their inner experiences and emotions. Art therapy and coloring can also be done in a variety of places. Some of the places include hospitals, nursing homes, private therapy offices, as weird as it sounds, it's true, and educational settings such as primary, secondary, or post secondary places. Now, taking this project one step further than what I had to, I thought of and researched some implications of art therapy and coloring. And I think art therapy and coloring could be carried out in the recovery protocols and care practices of patients in hospitals when they're doing things such as awaiting tests or preparing for surgery or procedures or anything of that sort, which can also be done individually or by a group setting. The practices of art therapy and coloring could also be brought into nursing homes and community centers, in addition to the other activities that they offer. Talking from experience, I personally work at a personal care home that has independent residents and those who have Alzheimer's disease, dementia, Parkinson's, etc. This is where I choose to have the mentioned residents participate in activities of crafts, games, coloring, or different art projects to not only make their lives more enjoyable, but rather help increase their mental benefits, as I've previously discussed earlier, to ultimately give their lives a sense of purpose instead of them just sitting there. As a third implementation of this topic, I think art therapy and coloring should be made part of the modern educational systems. In the primary school setting, students could do the activities of art therapy and coloring sort of as morning work, just as like a time occupier until their educator is prepared and ready for the day. And in the more advanced education systems, students could use the tactics of this topic to sort of walk away from their stresses without relying on the use of modern technology. And I also found a notebook on Amazon, as you can see pictured on the slide, that could allow for all of the previously discussed implementations to be carried out and documented. These are my references in the next few slides. Does anyone have any questions or comments they'd like to share?
My question, are you interested in this as a field?
I am. I sort of got an interest in it when I was in a previous class and we had to discuss something we knew nothing about. So I just thought it was cool to kind of give a simple activity to someone and actually get something out of it other than just the black and white, oh, they colored this red, this yellow.
I happen to be had a close friend who I grew up with, like 3 doors down from me, who went at the time Hahnemann, which was a medical school in Philadelphia. Now it's part of Drexel, I'm guessing, because I think they got absorbed. And she got her master's in art therapy there. Now I knew nothing about it, but I mean, she was there for a couple of years. I was just trying to look up, but I don't know her married name. Just to get it's from just telling the class. It's a very interesting field, very, very useful for a
It
lot
is.
of different age groups. I mean, we're not just, I think she was focusing more on kids than adults, but I think nowadays, as you were saying, there's a, for adults, particularly the therapeutic basis they have with Alzheimer's, pre-Alzheimer's type things could be very, very interesting. There's a lot of good schools in that area.
And a lot of like today's research, I didn't get a chance to look it up, but it influences PTSD as well too.
Oh, yeah, that's a very good one. We saw that before with Haley's presentation about the PTSD. That's great. Well, the first presentation I've had on this, I'm excited. That was great. Thank you. Anybody else? We're good. Relinquish the screen. Thank you. Who's next? By the way, my favorite rock album of all time. You know?
What's your favorite rock album?
Who's next?
Who?
The Who.
Okay, I figured.
Listen to that album. That's the best thing Pete Townsend ever did. All right, come on, take over. I'm getting
Is
my
that your favorite band or just your favorite album?
close to my favorite band, probably.
Do you want me to log you out, or I shared it with you? So
Yeah, you shared it. All these are up on here. I'll take away. You guys didn't even get that joke. Well, I'm trying to be progressive and clever. At least the 15 Commandments worked.
okay. So I did mine on color blindness. It's just a table of contents. Okay, background info. So vision in a healthy or normal individual is considered to be trichromatic, and the tri meaning the three chromatic, they're like three color or hues that your eyes have, which gives you the like range of colors you can see, and those are due to the photoreceptor cells or cone cells in your eyes, like cones and rods that we learned in physiology towards the start that Dr. Stein told us about. And each photoreceptor has a certain wavelength, and that's how you get the three colors of red, green, and blue. And as it says, the red is at 560 nanometers, green at 530, and blue at 420. And each of this is controlled by gene, the OPN1LW, MW, and SW, corresponding to red, green, and blue. So if there's any mutations in any of these genes, that's what gives the person the color blindness. And depending on what particular gene has the mutation on, gives the specific color blindness. So if you have the red or the pronomaly, and that would be a mutation in the OPN1LW, and then respectively for the green and blue. The green is the most common color blindness, followed by red, and the least common is the blue one. So it is a this disorder has been around for quite a while. It was mentioned in King George III in his court in 1785. I think that's the earliest recorded we can find. So I'm guessing there could be one like earlier than that, but that's what I found in one of the articles that I read. It is an X-linked. It is on the like X chromosome, so males are affected more than females. So as it says, 8% of males, so 1 in 12, and only about 0.4%. So 1 in 30 females are diagnosed with some form of color blindness. And as I said, the mechanism for it is primarily mutation, and you can have different types of mutation. There's crossing over between the MW and LW, or single SNPs, single polymorphisms. These are the sites on the genes that are typically prone to cross over or switch bases, and that renders the gene useless. There's also exon skipping, that is after the mRNA is made and before the proteins can be translated. So diagnosing color blindness is mostly a non-invasive outside test that doctors or ophthalmologists can give. One of the most used one is the Ishihara vision test or the color plate vision test. However, you can do a like molecular genetic testing and look at the specific gene. It's pretty time consuming and expensive. So most doctors just use like tests like these. Like for this one, they would tell you to like trace the path of like the red in here or the green. And if you can do that, obviously you have normal vision. If not, you would be diagnosed with the one color that you can't see on there. Other one is the color plate test. That's I think the most all of us have seen is like a number in between the circles, and if you can correctly guess the number, you have normal or healthy vision treatment. So the most common and widely used currently is gene therapy, is where you're given a recombinant version of this virus, and that alters the DNA sequence so that the L cone genes in that OPN1LW, they regenerate and are restored the function of it, so you're able to see the colors. The others are mostly glasses or lenses that correct your vision. For phones, there are also apparently apps like DenCam and iPilot, which depending on what specific color blindness you have, it changes that spectrum of colors, so you're able to visualize it, like the glasses. They take some wavelength and block the others, So you're able to see the whole spectrum, which you wouldn't be if you didn't have it. And these are my references.
That's great, thank you. Yeah, I mean, it's an aside, my color blindness is sometimes associated with bipolar disorder. Yeah, I read that, and I heard that from someone who was working with one of my kids, vis-a-vis bipolar.
I did diabetes. Perfect. All right, diabetes is a chronic disease that occurs when a person's pancreas no longer makes insulin or responds differently to insulin. This is a disease that 8.7% of Americans are diagnosed and living with. And insulin is a hormone that the body normally makes. It allows glucose to enter the body's cells to then provide energy. There are two types of diabetes, type 1 and type 2. Type 1 is where the pancreas does not make insulin. This makes it hard for the body to regulate blood sugar, and the body attacks the cells in the pancreas that make insulin. This results in no insulin being made, and type 1 is caused by genes, environmental factors, or infection, and these things can trigger the disease. Type 2 diabetes is when the cells are not responding to the insulin the way they should be. This is also known as insulin resistance. The body tries making more insulin in hopes the body will eventually take to it and start using it correctly. When the body does not use it, the blood sugar levels start to rise, and that results in high blood sugar. Type 2 can occur when a person is overweight or inactive, and there can also be family history that triggers this type. Symptoms of diabetes: urinating often, very thirsty, losing weight without trying to, very hungry, blurry vision, numb or tingling hands and feet, fatigue, and dry skin. High blood sugar symptoms: stomach pain, fever, dehydration, headache, and abnormal heartbeat. Complications that stem from diabetes are nerve damage, heart disease, kidney disease, vision issues, hearing loss, mental health issues, and limb loss. And how to avoid diabetes: lose excess weight, be physically active, eat healthier foods, get routine blood work done, and be aware if it runs in your family. And here are my references.
Very good. You can't know enough about it because it's going to touch your life. That's a consistent theme with us. Is anybody else here? Or because I know that Sierra is going to present as soon as she gets back. So we're good, right? And to you guys, so if you haven't, let me know, send me slides, whatever.
Presenting to
You are,
Yeah.
you can come.
Unless you don't want me to,
I am happy to have you present. I forgot.
I sent it to you a while
Yeah, you do, yeah, I'm just, no, that's fine. I was trying to get out of here. Oh,
I'm sorry.
it's okay.
I mean,
You're allowed to be here
I'll make it quick.
all the time.
So I did my presentation on dehydration just because I work out a lot. Like, this is something I probably suffer with, and I need to get my water intake up a little bit. So I figured I'd learn more about it. So we'll be talking about just like water recommendations, the guide showing like water intake for men, women, pregnant women, breastfeeding women, and why you should even care about something like this, as well as practices and strategies, how to stay hydrated and avoiding dehydration. So this is just an approximate guideline. However, all of these are just general, and they also depend on your weight and size. So you've probably heard like, oh, a gallon of water a day, that's a pretty good like estimate. Sometimes that can be too much depending on your weight and size. So for a guy around like 19 and older, you need about like 104 to 120 ounces. However, could be a lot different if you're 300 pounds and like 6'5" or something. And for women 19 and older, about 72 to 88 ounces. For a pregnant woman, it's around 80 ounces. And for breastfeeding women, it's around 104 ounces of water. So why does water matter? Why does this matter? Water helps restore fluids that is lost either during metabolism, sweating, breathing, during your waste removal. It also keeps you from overheating, such as through like that sweating process. As well, it lubricates your joints and tissues. It also promotes healthy skin. However, drinking a bunch of water won't guarantee you really clear, beautiful skin. It also promotes digestion. So it can have causes if you don't drink enough or too little. That can be like diarrhea or constipation. And without water, you're likely to die. You really can't survive at least like 3 days without water. Now, depending on other liquids, but without water, it's very unlikely you will survive. So what is dehydration? This is the loss of body water without sodium, as well as the water lost is more than replaced in the body. This can impair the ability to maintain thermoregulation and the ability and water balance during the time you exercise. This is particularly in warmer conditions compared to cooler conditions just because of that sweating and using your metabolism more in that heat. And it's found to inhibit cognitive function and motor skill performance. So just some symptoms and risks. So symptoms are fatigue, confusion, short-term memory loss, mood changes, irritability, dizziness, and extreme thirst. And I can say that they're definitely accurate because I did experience this when I was down in Florida because I wasn't drinking enough down there and definitely almost passed out down there. And increased risks if you are experiencing dehydration. That can be kidney stones, gallstones, urinary tract infections, constipation, heat injury, and low blood volume shock. So with water and physiology, so thirst kind of drives your need for water, and it's driven by physiological and behavioral cues. Aging also can influence your water intake. As you age, you decrease in thirst, as well as the body's regulation of fluid decreases. Other associated physiological responses are cardiovascular strain, hypothermia, and reduced skin blood flow. As well as we mentioned before, no water equals serious illnesses or even possibly death in serious cases. So how to avoid this issue? Make sure you're drinking enough water. Find out how much water is needed for your size and weight, height, etc., and for your activity level. A good guide to this is mostly half your body weight in equal of ounces of water. However, this can definitely vary depending on your activity level, height, weight, etc. So what if you don't like water? Something I did was take an electrolyte supplement. That's a water multiplier. But do be careful of the side effects of these because sometimes they can affect your body differently due to the other supplements in there. But I do use it as well. Maybe you're forgetting to drink water throughout the day. Use an app. I use an app. It reminds me throughout the day to drink more water just because I don't get that thirst kind of feeling that I should have it. But there's a lot of apps that remind me to like exercise, meditate, drink water, etc. As well as eating fruits and vegetables that are high in water. Things like melons, cucumbers, other high like fruit foods, I guess, can help you, as well as trust yourself and use your thirst as a guide throughout the day to know when you should drink water versus when you don't need to. And just stay hydrated, drink your water. It'll help you in the end. These are my resources.
Very good. Very good. One to go. You're ready. Don't feel compelled. You can try go back to my email. You can find it. That's the last.
You can
Oh,
next
okay,
time
I'm
my,
sorry.
just hit that. Sorry.
No, you're fine. So today I'm going to be talking about the lymphatic system. So what is it? So to get into a little bit, the lymphatic system is responsible for maintaining fluid levels in the body. It's a detailed network of tissues, vessels, and organs, essentially collecting extra fluid that circulates throughout the body. Some key parts of the system are the lymphatic vessels, the lymph, which is just the fluid, and that's just more of the specific term for it, the lymph nodes, the spleen, and the thymus. It works alongside the circulatory system, assisting it in its own functions, as well as playing a key role in the immune system. So like the lymph nodes contain immune cells. So what is it doing to/in and for the body? Again, it's important in immune function. So again, like we talked about, the lymph nodes have those immune cells in them. The lymphatic vessels are well-organized channels for antigens and immune cells to travel through, sending them all throughout the body and in the lymph nodes. These vessels transport any infected cells, again, to the lymph nodes to trigger adaptive immunity. The primary function, I found this in one of my sources, and it describes the function really well. It says to transport excess interstitial fluid from the interstitial space back to the blood circulation via the thoracic duct. So it just is like a fancy way of explaining all of the simple stuff I kind of put before, but I thought it was important to include because that's like the scientific definition. And interstitial fluid and interstitial space, if you've never heard those terms before, essentially it's just the fluid found in spaces around the cells, and the space is just that lies between the blood vessels and those cells. So if there's damage to this system, what happens? What can you expect to be going on in your body? So the term is lymphedemia, which is just the swelling due to the buildup of that lymph fluid in the body. Again, the lymph nodes aren't draining, which kind of leads to what some of the symptoms we'll be talking about. So the lymph nodes aren't draining, and the other vessels that are a part of the lymphatic system aren't draining as well. So swelling is most noticeable, and that's the main symptom of this. So you're going to see it in the arms, in the legs, and the joints can feel stiff. There's higher risk of infection, slower wound healing, and skin changes and breakdown of the skin. So there's two different types of lymphedemia. There's primary, which is hereditary, and then there's secondary, which is acquired. Primary is really rare because it's a genetic condition, which is just a mutation in one of the genes that is creating the lymphatic system. So your body knows that it needs a lymphatic system, so it's very rare that you would form and have that genetic condition just because the lymphatic system is so important to our body functioning properly. And again, the secondary is acquired. So it's caused due to the obstruction in the lymphatic vessels, which is more common. So how do we avoid this and how do we treat it? I want to talk about treatments a little bit more on this slide and how to avoid later. But avoiding it, just stretching, exercising. If you do notice any abnormal swelling that you've never seen before, consult a doctor. But treatment specifically for the lymphedemia, it really depends on how severe the patient's case is. And again, it could be very minor and kind of go away with compression socks, or there might need to be more extreme measures like medication and draining of the fluid. So again, exercise, stretching for avoiding. And there's usually, again, a combination of physical therapy. There's massages, those compression socks, and wrapping with bandages. And again, just the lymph massages. What else? Treatment's also focused on mainly just reducing the swelling, because once lymphedemia reaches a point to where it can't really be fixed, you're almost kind of stuck. But that swelling, the skin is stretched out so far, there's too much fluid, and to a point where that all of it can't even be drained at once. There's like multiple sessions of the draining. And medication for this can cause more of the skin infections that you might be experiencing. So if medication is needed, it's done very, what are the words I'm looking for? It's important to consider the patient's severity first before giving them medications, just because it's going to worsen some of the symptoms they're already having. Antibiotics are prescribed in conjunction with the medications if they are necessary, just to get rid of those infections that might come up. So I have just a couple images up here of what lymphedemia looks like. There's more of an animated one, and you can see kind of what's going on inside of the body underneath the tissue and underneath the skin. And then these are just some real life examples of lymphedemia. So in conclusion, the lymphatic system plays a pivotal role in the body functioning properly and us staying healthy. It works in conjunction with the circulatory system and assists the immune system. The lymphatic vessels and all things related need to be properly draining. Otherwise, there are consequences like the lymphedemia we just talked about. And to avoid, exercise, stretching, regular checkups, notice anything abnormal in general with your body, consult a doctor, please. Here are some references if you want to read more about it, anything intrigued you. And if you have any questions, feel free to ask.
It's great. a neglected system. Can't hear much about it. So we just need to get the rest of these in, and I'll probably dedicate one day to some review stuff for the final, and we should be all set with our adventure into physiology. Such as it is. All right, everybody. We're good to go. Have a wonderful weekend. Nobody else presented, right? Did I miss somebody? Oh, okay. Goodbye. Have fun. Have fun storming the castle.